Okie dokie. Hi, everybody. I'm Jessica with BCID.
And I'm Jose Hernandez with United Spinal Association. And we're here to present Rose from Social Creatures and David Putrino from Mount Sinai's research lab. So before we have introduction, Jessica's going to go through our
Housekeeping
rules.
So, as always, we have our wonderful Stephanie here with us today. If you have any questions, you can go ahead and put that in the Q&A section or in the chat box, and we will answer them after or during our conversation. We're kind of just going with the flow here. Yeah.
Yep, and if you need ASL interpreter, you can pin her. And oh, you said that already?
No, she's already there, and you can see her.
No, but if you don't see her by any chance, you can right-click and pin her.
Yes.
Just say it's we got it covered. So, okay. Rose, let's start with you. Tell us about yourself, your background, and a little bit about your organization.
Sure, yeah. So I'm Dr. Rose Perry. I am a social neuroscientist. I mostly do social neuroscience research, and also I recently founded a nonprofit organization called Social Creatures. And yeah, we just started back in March, and we are really focused on making sure that we're bridging technology, science, and advocacy to ensure that any individual can connect with others no matter the circumstances. Our organization is made up of social scientists like myself, but also we have technologists, we have creatives, we have community leaders and change makers, and we've come together to achieve this mission because we've seen across all of our disciplines how important social connection is, and we've seen firsthand the power of social connection. So we just are really trying to take an interdisciplinary approach to making sure that anyone can stay connected, and this has become more important now than ever as we are dealing with the pandemic. Yeah, so that's what we're about.
David?
Yep, my name's David Putrino. I am the Director of Rehabilitation Innovation for the Mount Sinai Health System, and a lot of my work is just around finding new and exciting ways of providing the care that we need for individuals who have specific care needs, and finding new technologies that can assist individuals, finding new ways of interacting with patients and other individuals to make sure that they never feel alone, that they feel taken care of, and generally rapidly working with new and cool technologies, and helping those technologies through all of those crazy sort of regulatory pathways that you usually need to go through that take years and years and years. We try and bring that down into, a much shorter amount of time to get helpful technologies into the hands of patients as quickly as possible.
I'm going to jump in right quick and say that, I've been injured for 25 years, and technology has come a long way. Unfortunately, a lot of those technologies don't get used within the healthcare industry. Like smartphones surpassed the technology for the hearing impaired. Like, why do you think that the technology advances faster than hospitals utilize them? That's just something I came up with right now. I was just thinking about it.
It's a great question, and I think I think that the general answer is what I would call siloing. Hospital systems and scientists traditionally are very bad at reaching into industry and collaborating with industry to make things happen. And so when I first moved to Mount Sinai and started our first clinical and research center at Mount Sinai, which is called the Abilities Research Center, it was one of the first of its kind in the world, where we said, there's all this great innovation happening outside of the hospital. We're going to reach out to those industry leaders and and bring them in and rapidly accelerate their path into the clinical population. And the response to that was overwhelming. We're really fortunate to see how so many industry leaders have stood up for the challenge. But interestingly, the response in the academic world was quite opposite. They were like, "Oh, you're not doing your own science. You're taking other people's science." And we were like, "No, no, no. we're responding to a need in the community because our stakeholders are individuals with spinal cord injury. Our stakeholders are people who are recovering from a stroke. Our stakeholders are people with Parkinson's. They're as much a part of the lab as anyone who works in it." And that, sadly, is a novel situation for science, but it allows us to do things differently. It allows us to do things faster than the average scientific lab.
I'm going to come back to that because there's a whole topic there all by itself. But Rose, tell me a little bit more about what you do and what your organization offers to individuals.
Yeah, so like I said, our big thing is making sure that people can stay socially connected. And we are really leveraging technology to try to achieve that through a number of ways. But before I kind of go into that, I just want to kind of set the framework a little bit more as to why we think it's so important. Like, obviously, I think most people feel when they're disconnected, they don't feel as happy. They might feel over time it's not so good for their mental health. But the research is showing more and more that it's also not good for even your physical health. So if you don't have strong interpersonal relationships in your life, or you don't have a lot of social ties, you're at significant increased risk for heart disease, high blood pressure, stroke, dementia, and even immune system dysfunction. So it's not great. There's also been multiple studies now that show that without strong social relationships, you are 50% more likely to die prematurely than people with weak social relationships. And that's a huge amount, 50%. That risk factor is actually equivalent to smoking 15 cigarettes a day. And that risk factor is more than if you do not exercise. And it's more than if you have excessive alcohol consumption, just to kind of paint that picture for how important this is. We call our organization social creatures because we are social creatures. We are wired for it. We need it. It's essential to our health in the same way as food and water is, really. So when the pandemic happened, we were very concerned, not only because of the pandemic itself and the health risk that comes with the coronavirus, but also the health risk that comes with social isolation and social disconnection. So that's where technology comes into play for our organization, is how can we be using technology, especially during these times, to keep people connected. So we have our first initiative that we launched was the Digital Safety Nets initiative. And it really was all about getting technology into the hands of people who did not have computers in the home or tablets in the home, so that, as everything has been shifting to digital strategies, like even having this over a Zoom webinar, everything is online now. There is a huge amount of population that doesn't have access to that and still do not have access to that. So we're really battling against that digital divide by raising crowd funds, and we have Social Creatures merchandise that we're selling, that we donate all the proceeds into buying tablets and computers and distributing that. So we've partnered with a lot of great corporate sponsorships as well. David's lab at Mount Sinai has been awesome. Also, Logitech has donated quite a bit of devices to us. We've donated so far, since the pandemic started, over 800 devices to people, and we've been loading them with social connectivity software and apps too, so that you're not just getting a computer, but you're getting information about programs and ways that you can meaningfully then connect with people. So yeah, that's one of the major things we've been doing.
It's great because through the chapter, we partnered with you and
Yes.
David to help us, distribute 20 tablets to
Which was
um, our members that didn't have it. And the pandemic definitely showed the digital divide in this society, especially here in New York, where everything was completely shut down and no one was out in the streets. So yeah, no, definitely. Um,
Yeah, we've got a little photo of
yep,
Jose out
See it?
delivering.
that was
Okay.
one of the days that we were delivering the tablets.
Ooh.
Whoop.
Jose?
Yep.
There were a few organizations they named that I wasn't able to catch.
Oh, yeah.
You'd like to
So-
repeat them?
If you'd like to repeat that.
Sure. So we partnered with Mount Sinai, specifically the Department of Rehabilitation and Human Performance. Also, we partnered with New York chapter of United Spinal and Logitech
And Take Two Interactive
and Take Two Interactive.
as well.
They donated.
Take Two Interactive.
That's
Yep.
it. Yep.
Got it.
Thank you.
And this is a whole
Here's
bunch of Chromebooks.
David with a ton of computers that were donated.
My poor office. Jose, you know my office and how many boxes I have.
You don't have an office.
I got a store.
No.
I got a storage room.
You really don't have an office. You sit
Yeah.
at the table that's outside of your office.
Yeah.
You've helped a lot of people, and you sacrificed your office space for it.
It's a small sacrifice.
Oh, yeah, absolutely. You're gonna be in the back with everyone else in the cubicles.
It's coming.
So during the pandemic, we saw a surge of adoptions in animals, and I'm gonna say that because Jessica wanted to go out and grab everything that was around. She has a lot of animals. Is that because people needed that social interaction? Because now your day-to-day changed. You're not no longer getting up, going to work, and seeing your coworkers. You're getting up, putting on a suit, putting on the top half of your suit with sweats, and then you have nothing with you. You don't have no social interactions other than a screen. Did people go out and get pets to fulfill that void?
I think so. I don't have the data to say either way for sure, but I read a lot of what you're talking about, Jose, that across the country, animal shelters, they ran out, so to speak, of dogs and cats that were up for adoption, which is amazing. And I do think that a big part of that was looking for connection, and social connection can 100% come from a bond with an animal. It's not just human to human. So there's also physical benefits of having pets. So I think that there's definitely a motivating factor there. Jessica, I'm helping you. You can get more dogs now.
Dog, cat, 4 birds, 2 guinea pigs, a tarantula, 2 snakes.
Tarantula. Oh, God.
That's incredible.
Yeah, he won't let me get another dog. Tell him I need the social interaction.
Very good for your cortisol levels. It's very good for physiology. It's lots of good benefits of having dogs.
She
And
can
the
have
dogs
as
are good for each other too. They socially support
Oh,
one
God.
another. I
This is-
also am looking for another dog.
she can get all the dogs she wants as long as she's getting paid to walk them.
That's a good arrangement.
But they're not our dogs. They're someone else's. They go back home once you finish talking. So David, how would you use technology to better someone? Like, give an example of how the technology that you use can benefit someone.
Yeah. So, at the Abilities Research Center, we work with so many different technologies that range from apps and video games and virtual reality, all the way through to, you know, big exoskeletal robotic systems that help people get up and walk. And I think that all of these technologies have their pros and their cons. You know, like exoskeleton, cool. You know, like let's start right there. It's a cool technology. It's cool to see people walking around in an exoskeleton. Not so cool. It's massive. It's heavy. It costs around $250,000. It's you know, not exactly practical for everybody, but it's an advanced technology that I think in the future can do a lot of good. Mobile applications, you know, basically the flip side. It's like not as sort of crazy in terms of how it can transform someone's life with rehabilitation, but it's low cost, it's scalable, and it really can help lots of people quickly. A really good example of that was when the COVID surge hit New York. We, over a space of about 48 hours, what we did was we quickly took a mobile application that we were using to monitor stroke patients and make sure that they were healthy after their stroke. And this is something that we were doing pre-pandemic. And we quickly changed the app around a little bit, and our team, and you know, our amazing team, who, you know, Jose, you know some of them, but Laura and Jenna and Layla and Erica and Mar, and you know, we had this team of people who quickly contacted all of these people who were diagnosed with acute COVID and stressed out about their symptoms, onboarded them onto the app. And we started monitoring their symptoms on a daily basis. And by the time that sort of the surge was over, we had managed the care of over 1,000 people with COVID. And it was interesting to me to see that the integration of technology here, it went two ways. It didn't just help the people with COVID. There's a quote that I want to share that came from one of the clinicians, because by the end of it, because we had so many patients, we had about 30 different clinicians working on the app, making sure that people were healthy and safe. And one of the clinicians sent me an email toward the end of the surge, and she said, I'm quoting here, she said, "Before joining the team, I was feeling burnt out on clinical care. I felt I was working within a system and I wasn't sure that I was making a difference. I can't tell you how great it was to just give patients what they need and forget about all the red tape. This wasn't my area, but I made it my area." And to me, that was really touching to see how the social connection we brought about through the integration of technology, it went both ways. It was healing to the patient, but it was healing to the clinician as well, because we often hear this concept or this adage about, oh, you don't want to add technology to healthcare. It's going to take the humanity away from healthcare. But what we're seeing here is when you use technology right, it adds humanity to healthcare. It doesn't take it away.
And I'm going to say as well that there are individuals, we're fortunate in New York City. We can get transportation from here to any location that we want. COVID showed that telemedicine is something that needs to be investigated and really made better and accessible to more individuals, because there's people who live in rural areas that don't have access to any medical advice at all.
You know, no, I was just gonna add to that. You know, like I see with COVID now that people have more options, because I know there's a lot of people who cannot leave their home for one reason or another. And now because of telehealth, my mom, for an example, she does OT, she does PT, she does psychotherapy, everything through telehealth. And although I'm kind of hoping for when things get back to normal so she can go back, because also I think when you stay in the home and things come to you too easy, that can also be a little bit of a dangerous water. But I'm glad that she can still keep up with the services that she needs so she doesn't take 47 steps backwards, right? And I also wanted to acknowledge that Maria put a comment in, and I wanted to recognize it because she's this with the CHW program with Milanka. So anybody watching who's interested in it, please send me an email. I'll put that in the chat box. But she says, good afternoon. My name is Maria De La O. I'm a community health worker from BCID. How can we receive some of these iPads? Because of the many other members are low-income persons and can't afford one.
Yeah, definitely. I'm going to type my email address into the chat, but it's rose@thesocialcreatures.org. And I'm going to type that in as well so you can easily access it. You send me an email. We would love to donate as much as we are able to based on how much we've crowdfunded so far. So we definitely want to at least get some tablets out to you.
Yeah. What are some of the programs that you guys use to load up the tablets? You know, interestingly enough, I did not turn one of them on. And I was like, well, it was too busy giving them away.
Yeah, you were busy. That was the most important job, Jose, making sure
Yeah.
that
They get into the right hands.
yeah, you know, there's all sorts of stuff that we put on there. We put the standard social connectivity things like Zoom, Google, like Google Meet, Hangout. But we also found some fun ones as well. There's one called Rave, which you can be in sync watching videos from Netflix or YouTube, which is pretty cool. I use it a lot with my friends now. What else? House Party is like kind of like a video conferencing app, but you can be playing games at the same time. We just put a bunch of games on there in general too, games that you can be competing with other people, even if you don't know them, who are playing at the same time. But yeah, we put like almost 50 apps on each one.
Wow.
Yeah, with some primers of how to use them too, because it's a lot.
Well, no, you guys had a very detailed list of instructions that some people didn't follow. And we lost Jessica.
We lost Jessica.
She'll be back. There she go. So throughout the pandemic, what are some of the unique, have you had any unique encounters with individuals who, you know, reached out because they were feeling socially isolated or, you know, just needed some kind of assistance through your organization, Rose?
Yeah, I'd say most people won't reach out and say that they're socially isolated. I think because there's a stigma attached to it. But I'd say the coolest kind of organic thing that happened was we were on our Twitter and a teacher, I think he was a college professor, tweeted, it was like GIF, and the GIF was someone like holding their chest like they were upset. And he tweeted that when you find out that your star student had to write her final essay on her old smartphone. So like the picture that he put with it was like, it was really upsetting, right? So we replied to that tweet saying, we have computers, can we send one to your student, please? And that tweet went viral, which was interesting. I did not expect that to happen. And then we were able to send that student a computer, and we were able to reach many other people who had similar scenarios. Teachers reached out to us who had been spending months trying to get their students on internet. So we were able to get hotspots out to people as well, because unfortunately, a lot of the major internet providers advertised that they were giving 90 free days of internet, but when you went to actually try to hook students up, there were a bunch of caveats that were in fine print that was like, if the household had any outstanding debt within the past few months, that they didn't qualify, all sorts of red tape that, you know, teachers are already having to transition everything to online. It's not easy to be a teacher right now. And I will say that, and also say teachers have been going above and beyond for their students. So we've just been as much as we can, trying to send out hotspots. But this is a major issue. Like the access to internet is a bigger issue, I think, than access to devices. And there's maybe too much of a monopoly of who's controlling the internet in this country too. But yeah.
I am going to agree with that. And I'm going to say that, we do need some kind of regulation or some kind of subsidy for seniors and individuals with disabilities to access broadband, not just, your basic internet, but something that's going to get them by, because I'm fortunate enough that I'm able to afford broadband and watch my 4K movie streaming. But, the senior that lives downstairs, receives a tablet and has nowhere to connect to, because you only have a handful of companies that that have internet access, and they can't afford it. So
Yeah. And there are organizations that are creating like $10 a month programs and stuff. So there's people working towards that, but it's a big problem. It's going to take a while, I think, to have equity and internet access in this country.
but it's the same here. Some of the companies, the larger internet providers here, they do have some programs, but again, there's a lot of red tape and a lot of yeah, it's $15 a month, but $10 for the modem.
Mm-hmm.
Like, which I never understood why.
Yeah.
You want me to pay for your service, but I have to rent your device and then return it when I'm done.
Doesn't make a lot of sense.
Yeah.
And
So,
proving that you qualify for the reduced price internet is a lot of paperwork and red tape as well, which I think deters a lot of people from being able to enroll in it. So that's like a whole separate issue, but it's a problem as well.
but, it's also tech on top of tech on top of tech. So now you're trying to access internet that you don't have and get paperwork from someone that you can't see because we're in COVID. So you're trying to, go through some kind of web portal, but that's kind of backwards, because you're trying to get internet so you can access the internet to get the web portal so you can get internet. Just
Yeah.
yeah.
I think
How do you do that?
Yeah, I think a crisis like this really highlights just how much of a disadvantage certain people are placed at in the community. And so now's the time for action, at the very least. Now is the time where we can say, don't you realize how messed up this is? That, basically everything, I went to the I went to the DMV the other day, and I was meant to drop a document into a Dropbox, and they put a Dropbox out the front of the DMV because of COVID. And when I got to the DMV, they said, actually, you need an appointment to access the Dropbox, and you can only make the appointment online. You can't make it here. And there was a line of people flipping out. I love that the DMV is still the same, regardless of a pandemic. There's still just a line of angry people yelling. But it was just crazy. And then I got to thinking, I was like, well, what if I don't have internet? And if my car is my livelihood, I can't access this. It was crazy.
That makes no sense. So you have to. All you need to do is drop off paperwork.
Yeah, is in an envelope, and it was just meant to go into the Dropbox, and that I was not allowed to just go and put it in the Dropbox. I had to have an appointment to put it in the Dropbox.
Okay.
Or to get in the line. I needed an appointment to get in the Dropbox line. No sense. Yeah.
So they just could have a separate Dropbox where people can say, all right, if you just need paperwork to drop off, just go right there, drop it off, and be on your way.
Yeah.
Oh, Jessica's dying. You like that one, huh? It makes no sense.
No, it doesn't.
Someone asked in the chat if there's any way to receive a discount from internet providers. there is a website called everyoneon.org. I'm going to type that into the chat. And they have a really good search engine. So you enter your zip code and you can see what might be provided at low cost or discounted. So that's the best thing out there to check for that right now.
Cool. Yeah, and the crazy thing is that we're surrounded by internet. Literally. That you pick up your phone, you're connected to some kind of internet access. So there's no reason why, you know, whether it's cellular or, you know, regular data through one of the service providers.
It's crazy because, you know, going back to my mom and her doing all this telehealth stuff now, right? She doesn't have internet. And my neighbor is so gracious to allow us to steal some of his Wi-Fi because she doesn't use enough internet to justify the insane amount to pay a month, right? So she just does little games here and there and then her little telehealth calls. So Jose and I are in the same boat like the question Maria asked, trying to find a solution. And she gets kicked off because there's like 2 floors in between her and the neighbor, so who she's borrowing his Wi-Fi from. But it, you know, it's lucky that she has that, but not many people even have that much. You know, I live in a building that's filled with seniors and low-income people and people with disabilities. And I was conceived, born, and raised here. Anytime I talk about it, that's what I have to say. So I have a soft spot, you know, for my seniors. And Jose knows one of my dearest neighbors over here. So the social interaction and having access to all this stuff is extremely important. You know, I even invited her. We had dinner with our neighbor, you know, during the pandemic because all that stuff is important, and access to the internet. And, you know, we had to end up ordering some stuff for her during the pandemic. She needed a phone with the big buttons, but not everybody, you know, has somebody. So I love what you guys are doing.
And I think personally, for senior and disabled buildings, they should, and this should, I think you know, you should, they should have their own dedicated Wi-Fi. So like your building, Jessica, should have dedicated Wi-Fi for those who can't afford it. It's a subsidized building. They get federal subsidies, and they should have, you know, I don't know, a gig speed or well, they're going to need a little more than that, but at least, you know, the tenants could come down and sign up for 1 meg, 2 megs, and they can divide it. They can make that go far. So
And it's a little tricky because, like, to my knowledge, I don't think they even do senior and disabled buildings anymore. I think that's like a type of segregation that they don't even allow anymore.
mm-hmm.
But at the time my building was erected, it was 1974, I want to say. So like even the wiring and everything in the building is old. So it's hard, but I guess it can be done, and it should be done.
Mm-hmm. Yeah, and you don't, I mean, I'm a big proponent for the high-speed internet, obviously, but tech companies are getting very creative. We've partnered with one called the Family Room, and their software is like Zoom on steroids. It's on Zoom, but you can watch videos together, you can play games together while you're in the Zoom, and it was designed for families and children. But they made it when they were designing it, they really wanted to make sure that their service could be used for a child who had an incarcerated family member. And the internet in the prison system is very bad. It's very low bandwidth. So they designed it to be very resilient to a really low bandwidth internet environment. And it works really well. Like, I want to use it for all of my work Zooms because the quality is better and it's more resistant to drop offs and stuff that happens when the internet isn't great. So it's really cool to see how innovative people are, but at the same time, it's just angry that we have to innovate around these problems that we just can't solve the problem to begin with and get equal access to quality internet.
And we need a lot of advocacy because it's constantly, we're moving in this non-inclusive direction. You know, to give you a concrete example from from the healthcare world. You know, we sort of rejoiced when CMS released all of these remote patient monitoring billing codes, because it meant that we could monitor patients and deliver a better standard of care, and it was fully covered by Medicaid and Medicare. And in recent months, they've started to say, oh, you know, it's going to be more convenient for us if we only allow remote patient monitoring to happen if the patient has a smart and connected device, like a Bluetooth blood pressure cuff, and pairs it with a smart device. Whereas, you know, what we're doing with a lot of our patients right now is, hey, you don't have a smartphone? Here's a blood pressure cuff, $30, go home with it, call us up, tell us what your blood pressure is. And CMS is saying, oh no, that can't work because they're going to lie about their blood pressure. I'm like, yeah, you tell me the patient that's going to lie about their blood pressure because they want to have a stroke. Are you crazy? You know, and so that sort of policy, it weaponizes against disadvantaged communities and low socioeconomic economic status communities. So we're signing a bunch of petitions, and we're lobbying at CMS to stop that policy from going through. But these are the sorts of fights that we need to pay attention to, first of all, because I promise you, very few people know that this fight is even happening. And then we need to explain why it's important, because even if people know, they don't always understand exactly why it's so important. There's, you know, I promise you, there is a large percentage of the population who says who doesn't have a smartphone anymore, or who can't use a Bluetooth device. And then, you know, we need to take action and make sure that all of these disadvantaged voices get heard.
Yeah, Maria says she will be happy to sign the position and you know, sign on. Is there a sign-on letter that you guys have distributed? You know, is it just a petition for individuals to sign on, or
it's a petition for healthcare systems to sign on? So
healthcare systems.
Yeah. So as the director of rehab innovation, I signed on.
Okay.
But I will look out to see, and it sounds like Maria and Rose and I are going to be talking a lot from the chat. I'll see if we can find a more public petition to sign as well, or maybe we should just start one.
Yeah, maybe do a sign-on letter with organizations. You got United Spinal, you got BCID too right here, and there's others. You have all the ILCs in the city, and you can spread that nationwide. So yeah. What else? Anything else you want to cover, David? How about I talk a little bit about gaming and how
Yeah.
you was gonna do that. Well, I was gonna say, when I got injured, I played video games, and it becoming paralyzed, it made the wheelchair kind of first-hand nature. I got on and like, yeah, we're gonna teach you how to go around in this power chair. And I was like, no, you're not. I'm gonna teach you how to use this power chair that I just got in. Because video games, hand-eye coordinations, and you grow up into it. So David, you have used technology and gaming now to help individuals.
No, I'm going to intervene right here for the record. I'm just going to say I drive my chair way better than he ever could, and I teach him. Okay, resume.
Resume.
Incredible.
I should have knew that one was coming. But something, she drives her chair with her elbow. I was like, all right. While holding a 5-pound anything. She'll hold that. There you go. While texting in the street.
Very impressive.
While texting.
But but I got you beat in the van. I drive my car better than her. But yeah, we're competitive. How can gaming help a person with a disability in general?
Well, I mean, it's interesting. One of the first clinical research projects I did in my career, like about, oh God, about 15 or 16 years ago now, was looking at it. The Nintendo Wii had just come out, or at least it had just come out in Australia. So, it's probably 5 years behind the US. But I remember playing it, and at the time I was working in a hospital, working in rehab with kids with cystic fibrosis, which is a lung disease. And one of the things I noticed was when the kids came onto the hospital ward, they usually, exercise was really good to get them reconditioned after their chest infection, but they didn't want to do it because they were young and they were in a hospital, and they were usually on the same ward as someone with, emphysema, so like an older adult with COPD. And they didn't like being out of their room, seeming out of breath just from walking. That it was kind of a pride thing. They didn't want to, they didn't feel like that's what they should look like, And so I started playing with the Wii, and I remember I was doing the Wii boxing game, and I remember getting really out of breath playing a boxing game and thinking, okay, well, first of all, which patient doesn't want to punch their physio? That's a given. And then secondly, this is solid effort. And and it makes it fun. And so we deployed a couple of Nintendo Wiis into the patient rooms, and sure enough, kids loved it. We started getting lots of exercise going in these people with cystic fibrosis, and it was just as effective as getting them walking around the ward, but they participated in it more. We had more fun as a paired group. We bonded, the therapist and the patient bonded. And we started getting all these inside jokes going and things like that. So all around, it was just injecting that level of fun into the mix made things better and made things more inclusive and exciting. But then
I was going to say, it also brings in the competitive nature.
Exactly. The whole thing, it just makes things generally more enjoyable and less like work. And we started investigating how we could do this with other fields, and so then I started going down the sort of rabbit hole of neurorehabilitation with video games. And I've done a bunch of research on that, and my whole team is amazing, and this is a big area of research for the lab. But then we also just started thinking about, well, what about, because within my lab, we do so many different things, and we often work with high performance athletes, as well as working with people who are recovering from all sorts of different injuries and conditions. And so one of the things that we always think about is well, what are the high performance athletes doing? And that was when we started to think about esports and professional video game playing, and working with the spinal cord injury community. And some of the people on the call might remember Chris Scott. He and humanitarian of the year, Angela Riccobono, who definitely a lot of people know here. She contacted me one day about Chris and said, I've got a patient, I want you to meet him. He's amazing, and he needs something in his life. And so he came down to the Abilities Research Center, and Chris had a high level spinal cord injury, so he didn't have so much use of his arms. And we started talking. I was like, well, what do you want to do? What motivates you? What gets you excited? And he told me that gaming was so important to him. And he missed participating in gaming. And then he showed me how he gamed with such a high level spinal cord injury. And it was by use of a quad stick, which is a device that through certain mouth and head movements, you can interact with a screen and play a video game. And he was really good. He immediately beat me at NBA 2K on the Xbox. He was really, really, and Jose's giving me the shady look because he knows that I'm garbage at NBA 2K. So,
I think anyone could beat you.
But,
There it is.
Thanks. But when I saw the level of talent that he had, that was when I said, well, we got to form an esports team. And sure enough, we reached out and, oh, there's the quad stick,
Yeah, cool.
which is amazing. And we put a call out to the community and we said, anyone with spinal cord injury who wants to get involved in an esports team, you know, come at us. And before we knew it, we had a room full of people, and we had the beginnings of the Quad Gods, which is now a pretty competitive esports team that are training every day. Yeah, I'll quickly.
You're gonna share it. I'll share.
I'll share. We're missing Nairi here in the photo, though, I will say. So we're missing one member. But these guys are looking pretty smart in their matching Quad Gods jerseys.
We got. You want me to name them off?
Look at Blake's face.
Yeah, I know, Blake.
They got him good.
Joy from Blake. Yeah. So we've got from left to right, we got Alejandro, we got Blake, we got Sergio, we got Prentice, we got Jose, and we've got, I'm assuming Richard, I can't see. But
that is Richard, yeah.
I'm assuming that's Richard. You know, and this team has been going from strength to strength. They're, well, Jose knows it. They're sponsored by Mark Cuban. They're sponsored by Logitech. They have all of these amazing things in the horizon. And for me, and
yes,
there's the website,
so good,
which is really cool. The logo itself there for the Quad Guards was painted by Sergio, who uses a mouth stick to paint. And for me, it's just been such an amazing learning experience of how, if you start from the beginning and you design for inclusion from the outset, there's just no limit to what participation can be. And so it is the community and its society that places limitations on people. And it's the environment that is not designed correctly for everyone to live in. But as soon as you take away those limitations, as soon as you take away the environmental limitations that limit participation, what you've got is a team of badasses who can take on anybody. And, you know, that's the exciting and, you know, cool lesson that I've been learning from working for Quad Guards.
Absolutely.
You know what I say all the time, and you touched on it, is I want a world where accessibility is just the standard. Like, we don't have to advocate for it. We don't have to fight for it. It's just there. You walk into a paint and sip, and the stick for someone like Sergio who needs it is there. You know, you don't have to bring it in yourself. Well, maybe if it's in your mouth, that's a little, well, no, you can go to a hookah bar and get a little tip different for the same, so why not?
Yeah.
Right? I just want a day where just accessibility and access for all is the standard.
Yep.
Absolutely.
So, Rose, would you care to share anything else? We're coming up about the hour, and final thoughts, and if anyone has any questions.
Yeah, well, there was someone in the chat who made a comment that resonated with me, that some seniors are tech intimidated and refuse to give it a try. And we've seen some interesting things since the pandemic has started. So I'll just tell you what we've seen. We absolutely do see that seniors sometimes have mistrust of tech and they don't even want to try it. But we're finding that if we're offering the program in a way that's multi-generational, that seniors are more likely to try it and are upskilling in their tech literacy faster. And we're also seeing that when kids explain tech, so like if you're trying to get a senior on Zoom, a child will explain it better and have more success than other adults would. So we're exploring that a bit more as well, but there's this really cool multi-generational social connection going on that is up-leveling tech literacy. David's pointing to one of the programs that we started called Fitness, which is a seated fitness exercise program. It's a group exercise program done over Zoom that was created by the SCI community for the SCI community, but Social Creatures and David's center at Performance 360 have been facilitating it. And it's just kind of,
For
sorry,
the
go ahead. The organizations are Social Creatures and Performance 360 at Mount Sinai.
Yeah.
And yeah,
Program
so
is called Fitness.
fitness, as in seated fitness. Yeah, it's a little pun. So it can all be done in a fully seated position. But yeah, it was created by and for the SCI community, but it's kind of taken on a life of its own, and we've had lots of older
SCI community.
SCI, the spinal cord injured community, and we've seen seniors join it. We've seen individuals who are blind or low vision have been joining it because we just, again, as David was talking about it, we designed it with accessibility in mind from the beginning. Yeah, and just very surprised to see how many seniors every week are who before would say, I don't know how to use Zoom. All of a sudden they know how to use Zoom. And
You have to
yeah.
send me the information so I can get it to Maria de la
Yeah.
O and
Yeah, it's been cool.
continue spreading the word around and getting
Thank
more
you.
and more people to join.
Yeah, my grandma's been on it every week.
Yeah, every week.
I could never get my grandma to be on Zoom before, but now every week she's on Fitness. I've never
That's
really got
funny.
to see her so much. Now, it's awesome. So yeah, there's something about these multi-generational interactions that is pretty special that we're seeing in response to the pandemic.
All right. With that, any closing remarks? Yep. I was gonna say we regularly put it on our newsletter and send it out. So, but send it to me and I'll send it to other chapters and stuff like that, and
Awesome, thank you.
post it around. Any closing remarks? Anything else you guys wish to share or say? Any inspirational quotes?
I
Quad-
thank you guys.
Quad father.
The quad father.
Oh, wait a minute. He's the one I hear you say quad father?
Yes,
Yeah,
that is the
that's
quad
right.
father.
Oh, Lord have mercy.
I want to thank you guys for joining us and giving us the opportunity to hear more about your programs and sharing information. If anyone has any questions for these guys, you can always shoot me an email. My email is jhernandez@unitedspinal.org. And Jessica?
J. De La Rosa at bcid.org.
You want to put it into the chat?
I did. You want me to do yours?
Oh, yeah.
Well, thank you for having us.
Thank
This
you
has
so
been
much.
great. And thank
Yeah.
you for the great questions from everyone who's been listening and following along too.
Yeah, yep. Thank you, everyone, for joining.
Thank you, David and Rose. The
Thanks.
quad
Thanks.
father.
Thanks for having
The
us.
quad father.
That's hilarious.